NYSC anthem.
Show! The NYSC anthem at the count of 2. 1, 2.
Youth obey the clarion call. Let us lift our nation high, under the sun or in the rain, with dedication and selflessness. Nigeria is ours, Nigeria we serve.
Thank you very much. And once again, welcome. And joining us is the Director General, NYSC Brigadier General Mohammed Father. You're very much welcome, sir. With the unexpected arrival of the COVID-19 virus in 2020, safety measures and healthy environmental living conditions was of great concern. On this premise, the National Youth Service Corps, in consultation with the Presidential Steering Committee on COVID-19 and the Nigeria Center for Disease Control, put together a strong alliance to ensure the members by sustaining the safe conduct of the NYSC orientation camp activities nationwide. To this end, the 8th in the series of webinars is what we're holding today, where enlightening sessions will be held alongside addressing concerns of prospective corps members whilst ruling out relevant and reliable information on COVID-19, as well as educating the PCMs on measures put in place to ensure safe reopening of the NYSC orientation camps. And this is in a nutshell what the objectives of this seminar intends to achieve. On that note, let me quickly go through the housekeeping rules for the rest of our participants before we jump into the rest of the agenda. Please, all questions will be sent or posted in the Q&A section of the dialog box. You have the Q&A box. You can see it at the bottom of the screen there. Please do well to drop your questions, especially when we commence the panel sessions. And if you are not involved in the speaking or any of the speaking activities, please do well to remain muted so that we can have a seamless conversation. And of course, be advised that the recording of this session has already begun, and you can always come back to find it on the NCDC YouTube page. That being said, Your Excellencies, ladies and gentlemen, we will now invite for the welcome remarks a man who has a distinguished military career and a fantastic ground in the educational sector. He holds a bachelor's degree and a master's degree from the great University of Jos, Great Josite. And he's also a holder of a postgraduate diploma in education from the Tai Solarin University of Education, Ijebu-Ode, and a PhD in history, University of Abuja. Ladies and gentlemen, let's welcome General Mohammed Father, NYSC.
The Director General and Management Team of NCDC, Directors of NYSC, State Coordinators, prospective corps members, good afternoon. It is my pleasure to address you in this webinar meeting in preparation for 2002 Batch B Stream 1 orientation course due to commence on the 15th of June 2022. This program is jointly organized by NYSC and Nigeria Center for Disease Control as part of effort to sustain safe conduct of orientation exercises in the face of COVID-19 pandemic. While we thank Almighty God for the decline in COVID-19 cases worldwide, I must stress that we should not let down our guard until the disease is totally eradicated. This webinar, therefore, will acquaint you with guidelines, including the established safety protocols, as you said, to report to various orientation camps. Since the post-lockdown resumption of orientation courses, we have ensured strict compliance with all safety measures, guidelines before, during, and after the exercises. Also, cooperation of your predecessors contributed immensely toward achieving safe and seamless conduct of exercises. I therefore enjoin you to ensure similar level of compliance. As a result, of all prospective corps members shall undergo the COVID test is mandatory. COVID test is mandatory for all corps members, and also those that tested negative will be admitted to the camps. In event of any positive result, arrangements have been made with NCDC and state health officials for cases to be handled in designated treatment centers. Let me also use this opportunity to advise all prospective corps members to be security conscious, especially when traveling to their various states of deployment. You are strongly advised to board vehicles at only officially designated motor park. Don't stand by the roadside for a vehicle. It's dangerous because you may end up in one chance. Please, you must also avoid night journeys at all costs. It is my prayer that Almighty God grants you journey mercies. I would like to use this opportunity to express our profound gratitude to the Director General, management, and staff of NCDC for the immense support we have enjoyed since we began this partnership. We are particularly grateful for your consistent provision of rapid test kits, personal protective equipment, and educational materials. I assure you of our commitment to supporting all efforts to give COVID-19 a final kick out of the world. Thank you, and God bless you all.
Thank you. Thank you very much. Let me, Brigadier General Mohammed Fada. That was indeed a wonderful welcoming address and also advising the prospective corps member, not just for the safety of their health, but also for their security as well. Duly acknowledged and appreciated, sir. On that note, before we move on to the next address, which will be the opening remarks from the DG NCDC, let me quickly acknowledge right here with us from the NYSC, Director ICT, Mrs. Christy Uba, Director Corps Mobilization, Mrs. Victoria Angor, Director PRS Alhaji Ahmed Wada, Director Ventures Management, Prince Mohammed Momo, Director Special Duties Alhaji Musa Abubakar, Director Press and Public Relations, Mr. Eddie Megwa. Please, can we give high-powered NYSC delegation a round of applause? And thank you for always support. At this point, let me quickly invite for the address of the DG NCDC, Dr. Ifedayo Adetifa.
Colleague, the Director General of the NYSC, I'm delighted to be able to join you today to welcome our prospective youth corpers to what is now the 8th edition of the Safe Camp Reopening webinar. Their prospective corpers, as you all know, since February 2020, Nigeria, just like the rest of the world who started earlier, has had to contend with the COVID-19 pandemic. In the early days, this was associated with delays, with camp reorientation and posting of youth corpers. But working very closely with the NYSC and on the auspices of the Presidential Steering Committee on COVID, the NCDC came up with guidelines on safe reopening of NYSC camps. And as you are witnesses to it today, this is now the 8th edition of a safe camp reopening since the COVID pandemic started. And we are happy to report that we have not reported or found any upsurge in COVID cases during camps, nor have we recorded any deaths of any corps member in relation to COVID in this time. So these measures that we are put in place to ensure safe camping or safe camp orientation, working with NYSC and other partners, I believe have been really successful. So what is all of this about? You will hear more details about what will happen in camp, or what you should know in advance of arriving in camp from other colleagues that will be speaking here. But what I want to reassure you is that despite whatever inconvenience you may feel, to understand that these measures that are put in place to prevent, infection prevention and control measures are designed for only one purpose. And the singular purpose is to keep you safe and, of course, keep the people who have to be with you on camp safe. So please pay attention to everything that you are asked to do. Testing before camp, arrival in camp, physical distancing, implementing public health safety measures like mask use, physical hand hygiene, and physical distancing. These are all important to ensure that the camp goes on without disruption, and your camp, and indeed the camps of people coming after you, are not disrupted. So I wish you all very well a happy webinar, and more importantly, a happy camp orientation exercise. Congratulations again to our new NYSC DG on taking control of the NYSC saddle. We will continue to work with you to ensure that the health of our youth corpers continue to be preserved even during orientation camps. Thank you very much.
Thank you very much, Dr. Idayo Adetifa. Please a round of applause for DG NCDC. Dr. Ifedayo is very well experienced in general pediatrics, infectious disease, and in epidemiology. Before we go into the first academic activity of some sort today, I have been briefed that there is a poll that is supposed to be conducted and filled immediately. So please, all PCMs online, as you can see on the screen, the pre-webinar poll is for data collation and information gathering. So please do well. We're going to pause for the next 2 minutes so that this can be filled immediately. So thank you for your quick response. I can see serious activity going on. This is indeed typical of Nigerian youth. Very active, very proactive, very hands-on. Like the Japanese would say, Genbi Genbutsu, hands on the field. So we will pause for yet another minute and we'll get this done before we will have Dr. Ladun's presentation. So 1 more minute to go, please. Okay. And don't forget, you can still post your questions. If you have anyone that is bugging you, you might as well post on the Q&A box. I can see about 25 questions already. I haven't opened them yet, but I'm sure there are a couple of us who have gone ahead of the panel discussion, and that's fantastic. And of course, be advised, if we have taken a question that is similar to yours, I believe that should cover for your curiosity or for your information. We're gradually wrapping up with the polls. I can see close to 900 of 1,300 plus participants have responded. That is indeed very, very impressive. The clock is there, but I'm sure we'll definitely achieve all the answers before the clock is timed out. All right. So please, let's make it fast, or let me say faster than how we're doing. It has to do with testing of core members using the PCR machine, wearing of face mask in public places, and of course testing members as well, PCMs that is, using antigen-based rapid test kits, and of course the wearing of the air doctor tags. Someone said that the air doctor tags are meant for the rich. I don't know how true that is. And of course, ensuring physical distance in large gatherings. All right. So choose options that best describe protocols to limit the risk of contracting COVID-19 in the NYSC orientation camps. So let's know what you think. Let's know your perception, the couple of things you know about COVID-19, particularly as it has to do with preventing the spread. Whilst Dr. Oyelado Kuromade is getting ready for her presentation that has to do with measures in place to sustain the safety of the NYSC camps. All right. So I think we're done with the polls now. If that's okay, can it be taken off the screen so we can have a seamless presentation? Is that possible? We will wait for the poll to get off the screen before I introduce the next person. Okay. All right. So quickly, let's invite to educate us on the measures taken or steps taken to ensure a very safe camp. She is the Deputy Director, International Health Regulation Division and Surveillance, as well as the Epidemiology Department. So please let's welcome Dr. Oyelado Kuromade. Please take it away, ma'am.
I'd like to acknowledge the presence of the Director General, NYSC, in our midst. Also like to acknowledge the presence of the Director ICT, Director Core Mobilization, Director PRS, Director Venture Management, Director Special Duties, as well as Director Press and Public Relations for taking time to join this particular webinar this period. And special greetings and regards to all the core members on the call. This is another season why we look through the guidelines that have been put in place to ensure your safety in camp, and also an opportunity for us to listen to some of your concerns as we get ready for this orientation exercise. So just to provide a big background, a little background of what we're doing and how, why we're here today. This started as far back as in 2020 when we had the first case of COVID-19 that was confirmed in Nigeria, in Ogun State. And following that, there's been a widespread of COVID-19 infection globally, which led WHO to declare a pandemic in March 2020. And a series of events after that, as part of the control measures and strategy put in place by the federal government, there was total lockdown of activity, businesses, schools, to ensure that we limit transmission of this infection, and the education sector was not spared. All the institutions were closed down, also led to the suspension of NYSC orientation activity. And as at today, we have reported over 256 cases with about 3,000 deaths in Nigeria. And the map shows that every part of Nigeria so far has been affected. Following the country commenced phase down of lockdown and reopening of activities in 2020, following decline in the number of cases and the better understanding of the virus, NCDC in collaboration with NYSC management developed a guideline for safe reopening of NYSC orientation camps across the country. And that guideline is what is still operational today, and that is what we're going to go through in this webinar. The essence of the protocol is to ensure safe opening, smooth runnings of the camps, and also to ensure that we limit transmission of infection as much as possible within the camp environment. So the objective of this webinar is to familiarize the core members going to camp next week with the processes and the expectations for this safe camp orientation. First of all, to inform you of the preparation that have been put in place in the NYSC camp, and to allow the core members to understand what will be their roles in the process, and also to address your concerns as regards the incorporation into this plan. But before we dive down into the plans, really, a lot of people will be wondering, since 2020, why are we still talking about COVID-19 protocol? So we'll have this look at the global situation of this infection, looking at what has been reported over time. This chart is showing different regions that are reporting COVID-19 since the last of May. Now, worldwide, we are collecting a weekly report of COVID-19, and we still notice that countries are still reporting, especially United States is still the highest, with about 717 new deaths being recorded in the month of May. And cumulatively, daily, we still have about 250,000 cases being reported across the world, with about 400 deaths. Although there's been a massive decline in the number of cases, but just to give us an overview that COVID-19 is still with us, and we need to ensure that we keep up with the protective measures. And one important thing also is that all our core members are coming not just from Nigerian institutions, but different parts of the world, and we need to still ensure that we sustain this measure. And looking at the overview of the cases in Nigeria so far, Nigeria has recorded over 256 cases since inception. And so far, we've had about 1.2 deaths. We've had about 1.2 deaths, which is over 3,000 deaths so far. And the map shows that every part of the country has been affected. There is no state that is spared. And the core members are coming from all over the states within the country, as well as traveling across different states. So this is to show us that there is no particular state that is exempted from this infection. So we need to ensure that we still keep up with the measures so that we don't drop the balls and we don't have severe cases in the camp orientation during the orientation activities. So far, we've successfully run about 13 streams of orientation camps, and we've not recorded any major severe infection, and no single death has been recorded so far. It's because of these measures that have been put in place, and we have worked closely with all the core members. We've worked closely with the NYSC management in camps to ensure that these measures are strictly adhered to, and we hope to get the same support and we count on the cooperation of the core members, prospective core members that are going to camp next week. This is also to give an overview of the age-sex distribution. The COVID-19 so far has equally affected all gender and all age groups. Children are not exempted, as well as adults. Although more cases have been recorded in age group 19 to 50, and also there's been more deaths in cases above 60 years of age. Mortality has been higher among male population, but so far no age group or no particular gender has been exempted as well. So we can't say it doesn't affect women, it doesn't affect men. Every group so far has been affected. So the essence of this is to familiarize the core members with the guidelines that have been put in place at the camp. This guideline has been jointly developed by the NYSC management as well as the prospective core members, and has been revised twice in line with the new discoveries with COVID-19, as well as with the introduction of vaccine, which has been stated. So what are some of the activities highlighted in this guideline? First is registration process. So every prospective core members are to register and fill in their details on their NYSC profile page. And on this NYSC profile page, it is unique to an individual. It is not something you share across among your colleagues. And the guideline also will be uploaded on your NYSC profile, and you are supposed to click to accept the terms and the condition, which means you're going to abide with the proceedings within the guideline. And when you click on this NYSC link on your profile page, it will direct you to the NCDC portal, where you will fill in your information on a form known as the case investigation form. We'll collect information about your travel history, information about your vaccination status. We'll collect information about if you have any symptoms in the last 14 days, or you've been in contact with any infected individual in the last 14 days. Please note that also this has also been reflected to indicate other infectious diseases, not just COVID-19. Currently, we have monkeypox that is spreading across different countries. So these are part of the things we're going to elicit to ensure we have all the details. Once this self-reporting form is properly filled, you're going to click submit, and a QR code specific to you will be generated. And this is what we admit you to camp. You come to camp with this for a rapid test, rapid diagnostic test, which will be conducted in camp free of charge by our officials who are in camp. And the results will be available, be ready within 15 minutes, and will be uploaded immediately on the same portal, and you will get, you'll be prompted to go ahead for your registration. Please note, without this prompting, without the results, you will not be able to proceed to register in camp. Also, the other necessity measures that have been put in place includes batching of the core members. So you realize that for every mobilization now, we have it in streams. We have stream 1, stream 2 to ensure that we limit the number of people in camp at a particular time to avoid overcrowding. And also talked about the rapid test, and there are a lot of infection prevention control measures that have been put in place. For your safety, the use of face mask is still very much in place. There is need for you to also present your vaccination card in camp. This is to encourage you to take vaccines. And for those that have taken the first dose, there will be arrangements put in place to ensure that you complete the second dose while in camp. Temperature check will also be at strategic places in camp, and there are a lot of hand washing spots within the camp environment. What are the supplies that were expected that you come to camp with? Every core member should come to camp with face mask and sanitizer. But in terms of hand washing, water and running water and soap will be made available in camp by the camp officials. And also, we've worked with the NYSC officials as well, NYSC management, to develop an IEC materials that have been distributed across the camp, and they are placed at strategic locations in camp. It's important to note that our concern is your safety, first of all, and also your convenience in camp as much as possible. And for every prospective corps members, the first thing is for them to have fun. So we make sure that despite all these measures that we put in place, we still ensure that you have your expectations are met as much as possible. So what are the concerns? What are your concerns as regards these measures that have been put in place? Our own concern is to ensure your safety. Next. Our concern is to ensure your safety, to ensure that despite the measures put in place, it's convenient for you, as well as you have fun as much as possible. But as prospective corps members, we seek your cooperation, and we want to charge you to take responsibility as much as possible. You take responsibility for yourself while in camp, take responsibility for your health, for your safety, take responsibility for the safety of your colleagues as well as the officials who are taking care of you in camp. And also, you take responsibility even for the sake of your parents who are expecting you to return back home safely. And to do this, we encourage you, we charge you to ensure that you adhere to this guideline. After the webinar, the guideline will be posted on your portal for you to go through and get more familiar with what is in the guideline. While in camp, observe physical distancing as much as possible and avoid overcrowding. Ensure that you keep up with hand hygiene. As I mentioned, apart from COVID-19, we still have other infectious diseases like monkeypox. Lassa fever is still with us. There is yellow fever. So hand hygiene is a basic IPC measure that you can take at any point in time to protect yourself. And when in doubt or you have questions, please seek clarification at the right channel. Do not seek clarification on social media or post any instigating event on any media. Seek clarification from the NYSC clinic officials. And we encourage that you consistently keep up with the use of your face mask when in a gathering, and also cooperate with both the NYSC officials and the NCDC officials while in camp. And remember to come with your COVID vaccine, especially those that have not completed their second doses, or those that are yet to take booster. The essence is for you to take, to utilize the opportunity of orientation camp to complete your vaccination or COVID-19 vaccination process. And if you have any symptoms, headache, fever, not feeling well, report early of any symptoms. Even if it's skin rashes, please report to the right channel and to the right quarter. Caution, we'd like to also reiterate, first of all, we need to familiarize with the measures that have been put in place, comply with the protocols that have been put in place, and also avoid posting, instigating information, unnecessary information on the social media. There is official communication channels that have been put in place at the camp, at all the camps, which you have access to the officials, you have access to the clinic where you can escalate any event to immediately. Everyone has a role to play. We have done our home part by ensuring that these measures have been put in place. We have worked with the NYSC management to ensure your safety. As you go to camp next week, please do your home part, and we all have to play our role very well. Take responsibility for every action you take while in camp. Thank you.
Thank you. Thank you very much. Please, can we give a very big round of applause for that erudite, and prolific presentation, of course, by a renowned doctor and epidemiologist, Dr. Oyelado Okoromade. That is indeed very, very enlightening. And I believe that some of your questions, over 200 of them that I see on the chat box, has already been answered and addressed. However, there's still a flurry of other information we want to reel out to you. And that is why we are going into a panel session. Already the panel session has been formed, led by the DG, NCDC, as well as a team of directors here present. And of course, Dr. Ladun is representing the NCDC in the panel session. But I need to quickly just find out before we take the questions. Do we have any? Do we have anything? Do we have any of the directors that want to make a very quick statement or speech or something before we start taking questions?
Progress. There's none from this end.
Okay, thank you, sir. And on that note, the panel has been formed, and let me quickly go through the questions and see the ones that we. Of course, I believe the usual one that they always come up with. I think DG, sir, you or any of the directors might take that up real quick. They are asking about call-up letters. How soon are they getting their call-up letters? So can we just take that on first, sir?
The call-up letters will be ready by Sunday. By Sunday, being that should be on the 12th. So 12th of June, yes.
Okay, all the call-up letters.
Yes.
All those will be mobilized.
Yes, they will print online.
Okay, yes. Okay, because someone was talking about printing, so online. So PCM, there you have it. Your call-up letters will be ready Sunday.
To be in their phone. On Sunday, everybody will get his call-up letter. That's on the 12th.
Now, the call-up letters, they will all be released at the same time, but on each person's call-up letter, the scheduled date to go to camp will be specified.
Okay. Okay. Thank you, sir. Thank you, ma'am. So PCMs, there you have it. Your call-up letters will be coming to you in a matter of days. It will be sent to your phones. So be looking out for them. All right. And some other people, I think this will go to Dr. Ladun and NCDC. Someone is saying that he's been vaccinated. Does he or she need to be subjected to still taking a test and camp? Will showing your vaccination card suffice?
So with the vaccination card, everybody will still be subjected to a mandatory RDT test. It is a process put in place because okay. So everyone that's been vaccinated would also be subjected to RDT screening because we're ensuring everyone that will be in camp have been fully vaccinated. That is one. And then secondly, this is an exercise that everybody will be in the same environment for a period of 3 weeks. So everyone that would be in that camp for that period will still be subjected to RDT screening. It is mandatory. Thank you.
All right. Thank you. And then quickly with you, Dr. Ladun, I don't know, some people are saying their COVID slip is not out. What's that about, man?
Okay, so the COVID slip they mean is after filling the case investigation form, the QR code they're supposed to download and bring to camp for testing. So I'm going to escalate that to the IT team. They will look into that and ensure that they rectify that. Thank you. Over.
Okay, and still on you. Some are saying they've taken their first doses of vaccines. Will there be opportunities to administer the second dose in camp or vaccination generally?
Yes, so there will be an opportunity to have the second dose in camp, and there will also be an opportunity to have booster for those that are looking forward to getting their booster in camp as well.
And those who have never been vaccinated at all, can they begin from when they report to camp?
Sure. Once the NPA-CDA team that are doing the vaccinations are in camp, for those that want to start, would start wide in camp, and they're going to receive their card. And after orientation, they can continue with the second dose at any facility.
Okay, so that means when it has to do with vaccination, PCMs, please note, if you've never been vaccinated, you have an opportunity to begin when you come to camp. If you've had a first dose or a second dose opportunity will be there. Booster shots opportunity will be there. And if you've been vaccinated, you will still be subjected to a test, even when you present your vaccination card, just so that we can all be on the safe side when it comes to data collation and gathering. NYSC.
Okay. So if I may add as well, please note that the screening is the one that is mandatory and compulsory. Vaccination is not compulsory, but you are encouraged to get vaccinated. Thank you.
Okay, so thank you. That was a very wonderful clarification. So nobody is going to be forcing or enforcing anybody to be vaccinated on camp, but it's advisable for you to be vaccinated. All right, well clarified, ma'am. Okay, so for NYSC, someone is saying, will newly wedded people or particularly pregnant ladies be allowed in camp? I guess when they left school and when they mobilized, they got themselves involved in marital activity. So if they find out they are with child reporting to camp, will they be allowed?
Child, it's not an infant.
No, pregnant women.
Pregnant women are not allowed to camp. Because, pregnant women are not allowed in this. They will register and leave. Because the camp environment is not friendly for pregnant people. They register and leave. And nursing mothers, our facilities don't have, we don't accommodate pregnant and nursing mothers.
Okay. All right, so that says it, that covers it. And so still on NYSC, someone is saying, or a lot of them are actually saying that the COVID-19 online test is not yet available on their dashboard.
Yeah.
I would think the director should take that up.
It's not yet available. It will be available by the time the call-up is released. Once the call-up is released, they see it on the dashboard. The link will be there for them to fill the slip. The COVID-19 slip. That's at that point. For now, it will not be available.
Okay, so that means that if we're going by the June 12th date for call-up letters, shortly after that, you will see core members, PCM will see their dashboard. Okay, yeah, fantastic. Okay, so PCMs, I hope you're noting while you wait for your call-up letters, immediately they drop, the COVID-19 registration will be available on your dashboard. And some other people are asking, due to distance, transportation, and what have you, if they are unable to report to camp on the exact day, will they still be allowed? Should they show up a day or two after?
Yes, they will be allowed. We all understand the logistic problems that we have currently, and the various states have been directed to use their initiative to handle such cases. So they are free to.
Should not be abused.
But they shouldn't abuse it.
Yes, it's advisable
Abuse.
they report on their stated date list.
Control
Their
the number.
reports. Should
To-
not be anything.
Okay.
To all the prospective core members, it's advisable they report the very day that they're supposed to report. But in case of unforeseen circumstance, they can report one day or thereabout to the camp. It's allowed. But they should not abuse it.
Okay. Yeah, and it's advisable for them to report so that they can get good bed spaces and good positions.
Because it
And
will
then for
serve
their own
as this camp.
Yes, sir. Exactly.
New
It's for their own
mattresses and
good.
other things.
It's for their own good. You know, it's for their own good. No problem, sir. Okay, but there's another one here. These are from the foreign students who are trying to get registered in Abuja, and they say they've not been verified. They are yet to be evaluated. And they're having challenges communicating with the people at the office. They were there on Monday for physical verification, and no one gave them due audience. So I don't know, is it possible for the DG or anybody to address
They
that?
have their schedule, a schedule for being verified, and they choose centers. We have 9 centers nationwide. So each of them is assigned, or he picked the center he wants to be verified, and they are waiting for them. They are there. They started on Monday, and they are still on. Abuja is Kubwa. We have in Kano, we have in Port Harcourt, we have in Enugu, we have in Sokoto, so they can choose. They were allowed to choose the center.
Let them go to their various closest or the one that is more convenient. We have 9 centers, and the officers they are waiting for them.
Ensure that
Okay,
they
as a
all their documents original.
Original, no Oluwale.
okay. No,
As-
so but as a follow-up
if
to
you
that,
carry, if you carry Oluwale on Natorio, and you go with the original, within very short time you finish and go.
exactly. So please, no Oluwele, no photocopy, no rank zeros.
And
Straight.
Toronto, no
Straight.
Toronto.
No.
Okay, so guys, ask again.
Let them carry the real one. It's okay. Let's make progress.
Yes, but as a follow-up to that, someone is saying that they did their physical verification and still no call-up numbers yet, and they've been trying since batch A, stream 2, and it's still the same issue.
Yes, we have a procedure. There's what we refer to as online evaluation. And that means that all the documents you uploaded on the NYSC portal need to be evaluated and you'll be cleared. Then the second stage is for you to be cleared during the physical verification. When these two has been done, the system will now generate a call-up number. But if only one is done, the system will not generate call-up number for you. So we encourage the prospective core members to make sure that they've done the physical. Then the NYSC, it is the responsibility of the NYSC Evaluation Division to work on all the uploaded documents and get them evaluated. So we'll go back and ensure that we clear every pending cases for online evaluation on the portal before
Okay.
we finally release the call-up letters.
Okay. And still with NYSC, some other people are saying, what are the security measures put in place in camp? I think particularly for those who the camps are maybe out of the urban metropolis. Like I know in Rivers State, the camp is in Noah.
Okay. I want to assure all the prospective core members that yesterday I had a Zoom meeting with all state coordinators, and they have done all what is supposed to be done, and the camps are safe for the orientation exercise. So let them feel very safe, and then just like what I've said, let them take very serious attention on their personal safety. But the scheme have done what is needful about their safety, and rest assured that they are safe. And I said they are safe, and what is that time? Very safe.
Very safe. Okay. Okay. Thank you, sir. And some other people are saying their schools, one particular, Ochade Emmanuel, that his school is yet to release his certificate, and he's already waiting to be mobilized on the 15th. So is there any alternative?
Please let him ensure that he goes to camp with his original certificate.
That's all.
Or statement of result.
Certificate. Because some houses are not his home.
Let them go to the camp with their
certificate. Not
certificate.
release certificate immediately.
Let them go with their certificate.
Is there any alternative?
Certificate or
No.
No alternative. Certificate and statement of result. Original.
Okay. Either or the two.
Both.
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 Preferably both.
Okay. Okay.
You have no certificate.
So, Emmanuel, please take note. Please take note. All right. Okay. So I think some other people are still. This is now coming back to NCDC. Somebody is debating that how is it possible to prevent, the whole spread and control when people are going to be sharing rooms, people are going to be really, sharing sanitary facilities and all of that in a very close proximity. How possible is this prevention and all of that? So what should they do in those cases where they can't really distance? Okay, Olado.
This is not the first orientation exercise that we have. All the necessary measures that will make sure that each and every prospective corps member is safe have been taken care of. And we have never had any negative happenings of such. So let him be rest assured that he's safe, and if there's anything, we'll take more measures on that, which I know there will be none.
Okay. But should there be, Dr. Ladu, if someone shows up and he or she is tested positive right there on the spot, what are the measures taken right there? Are you sending them right back home, or you're going to the arrangement?
The NCDC will not respond.
Okay, so we working with the NYSC management, we've put measures in place to ensure that they are taken care of within the state where they are posted to, and ensuring that they don't miss out on the orientation exercise for that period. And in measures in place where they are within the camp environment are what we have highlighted in the guideline. And that is why we're encouraging them to go through the guideline, get familiarized with protect themselves. But the major key thing is to ensure that at entrance, everybody is screened. And while they are entering the camp, we don't have any positive going into the camp environment with them. And another measure is batching, which Director Mobilization still talked about. When they're being called on, they have different dates that they are going to resume. This is to ensure that they are not overcrowded at a particular period, and they are able to resume in batches in camp, and some other infection prevention control measures. There is a surveillance system also put in place within the camp environment. We have our officials in camp with them for that period of 3 weeks, looking out for anybody with signs and symptoms. And there is a process where if any of such is identified, they escalate immediately to the state team. So all these measures have been put in place with the cooperation of the NYSC management, and can assure the corps members that they are in good hands. Thank you.
All right. Thank you very much, Dr. Ladu. I think that these few responses has addressed the bulk of the concerns aired here by the prospective core members. So please do take note. Your call-up numbers are going to be up from the 12th of June, which is about a few days from now, Sunday, that is. And that will follow with the COVID-19 registration displayed on your dashboard. So it is no error, it is intentional, it is a process, and it will be followed duly. Measures have been taken. If you haven't been vaccinated, not to worry. You will not be forced. However, you will be advised. If you have taken the first dose, all follow-up processes are available for you in camp. So safety and security-wise, health-wise, and hygiene-wise, the NYSC and the NCDC together, they've got you covered. So can you please give them a round of applause for their very wonderful initiative, putting it together. So we have beamed the light on the NYSC and what their responsibilities are as regards keeping a safe camp. We've reeled out the responsibilities and objectives of the NCDC. However, the core members, their PCMs, you all also have a role to play. And it's on that note, I'm inviting the head of communications, NCDC, Dr. Yaya Disu, I almost said Yaya Bello, Dr. Yaya Disu, who will be taking us on the core members. The core members as champions for health security. So Dr. Yaya Disu, aka Bello. Let's take your presentation, sir.
In collaboration with NCDC, has a program, the DG NYSC, called Surveillance and Data Validation. The DG NCDC in absentia, all directors are present, and then my colleagues in NCDC, partners supporting this. I want to say, I want to follow the existing protocol, and I want to congratulate all the protocol members. Basically, what I'll be sharing with us, because we have a very short time to discuss this, is about the role of core members in the national health security. And as we are going to camp, securing our health is a priority for us. And it is important that everybody keeps for this. So, and it's not just about our own health, but the health of our community, the health of our family, the health of our friends. So we are not doing this in a selfish way. And then it is when everybody is protected that we can all say that we are protected. So, and it's not only COVID-19 that is a threat to core members. We have had in the past where core members died of meningitis and other diseases, Lassa fever, and then it is simple measures that we are already aware of and are cheap, cost-effective, that will have prevented this. But if those core members understood this, maybe they wouldn't have died from this. So this diagram just shows to us a brief framework for us to attain what we can follow to attain this national health security. First thing is we need to take responsibility in understanding the problem around us. Most of us see problem and we shy away from the problem. And we don't want that to be happening. And then we need to understand that this problem cannot go. Problem of disease, problem of sickness, problem of disability, poverty. We need to take responsibility. And then the moment we know that we have roles to play in this, then it's not enough for us to just say, okay, we have discovered the problem, but we also need to be in driver's seat to make sure that we are leading on initiative to solve this problem. As we are core members, we are all graduates from various disciplines, and we have been prepared to be the leaders of tomorrow. We should be able to have vision for where Nigeria should be. If we have great vision and we have threats, to that vision, threat to our health, we will not be able to achieve that. So taking responsibility also means being in driver's seat, taking control, setting goals, and we cannot do this alone. We have to work with a team. We need to work with colleagues who are serving with us, work with the state health team, Ministry of Health, local government, wherever we find ourselves, community, because all of society approach is required for us to safeguard our national health security. And that is the only way we can solve problems. Together we can surmount any problem between us. Also, we need to understand that we are operating within circumstances that may be beyond our control. Some of this may be political, some of it may be economical, some of it may be socio-cultural, some of it may even be technological. Some you get to a place where there is no internet, and you should be able to think of what you need to do in ensuring that you bring health, you safeguard the health of yourself, of your people, of your colleagues, and the community where you find yourself. Together, that is the only way we can win. I'm sure all of us are familiar with Take Responsibility slogan for COVID-19, and then there is a model for implementing that. And then what it means is at individual level, at family level, at community level, at national level, at policy making level, we all have responsibility to play. We all need to model the behavior, hand hygiene, use of face mask, taking the vaccine. And then we also need to understand the structures around us that we can work, we can key into. Some other variations may even come from working on that. Then we need to also make sure that we share all the messages, not rumors. We need to be careful in doing this. And then ensuring that people who are disabled, who are vulnerable, they are able to overcome their problem, they are protected. So this is a concept that I try with some NYSC colleagues who have served in NCDC in the last 3-4 years. Is a game plan. I ask them a question: what is your game plan for this 1 year? Do you want to waste this year? Do you think that this is just here for you to enjoy yourself, leisure, and just pass time? No, this is not the time. And then the game plan is an acronym. G stands for gain. What do you want to gain this 1 year where you are serving? With regards to knowledge, with regards to skill, the experience, even mannerism, how you relate with people. What values are you going to have in exchange for what you are going to gain? Most people focus on money, that they want to gain money. It's not about money. There is time for that. If you build yourself, then money will follow you later. What values are you going to have? What is it that when you leave after 1 year, people will remember you for? So we need to make sure that we are relevant wherever we are. Little works that people run away from. Let us take those responsibilities. Let us do that. One of us today, Gordon, Dr. Gordon served in NCDC and knew work that he was doing, work that everybody ran away from. But today, we're all proud of him. Then, who are we meeting? We need to take advantage of people we are meeting. Opportunities for network building. That means we need to be careful the way we relate with people, the kind of behavior. We need to safeguard our integrity. Because today, when you are, for instance, in NCDC, you meet partners, you don't know where they're coming from. Some of them, they're from Geneva, from outside Nigeria, United States. And today, when you do, they will contact you after. Oh, can we engage you? But whatever you do, even if somebody recommend you, if you did not impress them, they will tell you they already know your capacity. Then what's your engagement plan? When you have already know what you want to gain, you have mapped out how you want to add value, how to take advantage of people you are meeting while you are doing your work, then how do you want to do it? You need to put it down and begin to work it and evaluate it weekly. That way you'll be able to know how far you are progressing. So in doing this, we must be a champion. Who is a champion? A champion is somebody who has passion, who has been able to find his voice in a particular need area, his relevance in a community, and inspiring others to find their own voice. It's not enough for you to understand your purpose, but also help others to do that. And then for health security, what this means is we need to support disease prevention effort. And then, of course, when information comes our way, we may be part of people who spread rumor or misinformation. We need to verify every information. and also ensure that others join in solving problems. My last slide is, are you ready to take the driver's seat? You can see this picture. Some people pass through NYSC, they just want their certificate and they move away. Some people say, okay, I want to be part of a mission. They are in a vehicle. Some are just sitting on the body. Anywhere I can find myself, I know that I'm part of this project. It's not just certificate. But somebody can also be in the driver's seat. Yes, I'm part of this project, but I want to also make sure that I lead on this or something, so that this is what my own contribution to is in the community. So thank you very much, colleagues, and I wish you a fruitful orientation camp. Thank you.
No, equally, it's not hearing us.
Yes. Let me call them.
But if people have sat for long,
It's already 1 o'clock.
Once 1 o'clock,
Oh.
it's up to.
Thank you very much, Dr. Yaya Yusu. That was a wonderful presentation. And at this moment, we'll be bringing everything to a wrap. I didn't know I was muted earlier. I was saying that Dr. Yaya Yusu sounded like the way Yaya Bello sounded in the primaries. Very convincing, but this time around, more than 47 votes, I'm sure. Anyway, we will be ending with a closing remark from the DG NYSC, Brigadier General Mohammed Fada, after we will have the NYSC anthem and the national anthem, and it will bring the entire proceedings to a close. So, DG, sir, please close us with your remarks.
I want to stand on the existing protocol. The prospective core members, I've said it earlier. Please follow all the safety protocols and adhere strictly to the instructions. Safety protocols and adhere to instruction in the camp. Your security is your path. We have done what is humanly possible for your safety, but much is your own personal safety. Take care of your personal safety is very important. I also urge you that take opportunity of your orientation camp to take COVID vaccine, COVID-19 vaccine if you have not taken, or do what is expected of the vaccine. Ensure you comply with all camp's rules and regulations. Rules and regulation in the camp is mandatory for you to comply and adhere to the rules and regulation in the camp. Take serious in all the necessary training that you will undergo during your mandatory 3 weeks campaign, please. Then on the part of NCDC, we sincerely appreciate and thank you for giving us this opportunity, just like the one that you have done before for webinar. Thank you and God bless you all. Good afternoon.
Thank you, DG NYSC. Thank you, DG NCDC. Also, quickly acknowledge support from the World Health Organization. We see you and we appreciate your support. The sign language interpreter, thank you very much for doing the wonderful work that you always do. My name is Dan the Humorous, and it's always a wonderful delight to always moderate this enlightening, educative, and informative session. And I believe, or rather, I can't wait to be at the next one. On that note, this has the 8th webinar, the 8th edition has been brought to a close. Let us now close with the NYSC anthem and the Nigerian national anthem.
Show! The NYSC anthem at the count of 2, 1, 2.
Youths obey the clarion call. Let us lift our nation high, under the sun or in the rain, with dedication and selflessness. Nigeria is ours, Nigeria will serve.
National anthem.
Nigerians come on men to serve our fatherland with love and strength and faith. Join them on in them to serve with heart and voice. One nation bound in freedom, peace and unity.
We thank you all.
Thank you very much. And PCMs, have a safe drive. Thank you, NCDC. Thank you, NYSC. Good day.
Thank you.